Your body has a small but incredibly powerful gland located right at the front of your neck. It sits just below your Adam's apple, shaped much like a small butterfly with its wings spread out. This is your thyroid gland. Many people go through their entire lives without ever thinking about it, yet it plays a central role in your overall health and well-being every single day. Think of it as the master control center for your body's metabolism. It is a vital part of your endocrine system, which is the collection of glands that produce hormones to regulate almost every cell, organ, and function in your body. The primary job of the thyroid gland is to produce, store, and release specific hormones into your bloodstream. These hormones, mainly thyroxine, often called T4, and triiodothyronine, or T3, travel throughout your body and deliver messages to your cells. The medical term for this condition is hyperthyroidism. In simple terms, hyperthyroidism means your thyroid gland is producing and releasing too much thyroid hormone. Going back to our car engine analogy, this is like having your foot stuck on the gas pedal. The engine starts to race, running too fast and too hot. This acceleration of your body's processes can affect you in many different ways, creating a cascade of effects that can leave you feeling overwhelmed, exhausted, and unwell. It is a condition that speeds everything up. When your bloodstream is flooded with excess thyroid hormones, your body's metabolism goes into overdrive. Because thyroid hormones affect so many different parts of your body, the symptoms of hyperthyroidism can be widespread and varied. They often develop slowly over time, making them easy to dismiss or attribute to other causes like stress or lack of sleep. One of the most common signs is unexplained weight loss. You might find yourself losing pounds even though you are eating the same amount as usual, or perhaps even more. You may experience a rapid or irregular heartbeat known as palpitations. It can feel like your heart is pounding, fluttering, or skipping a beat, even when you are at rest. You might also notice a fine tremor, usually in your hands and fingers, which can make delicate tasks like writing or holding a cup feel difficult. People with hyperthyroidism often feel hot and sweaty when others feel comfortable. This increased sensitivity to heat is due to your revved-up metabolism generating extra body heat. Hyperthyroidism can affect anyone, from infants to older adults, but it is far more common in women than in men. In fact, women are about 5 to 10 times more likely to develop a thyroid condition. A family history of thyroid disease is another significant risk factor. If your parents, siblings, or other close relatives have had thyroid problems, your chances of developing one are higher. The most common cause of hyperthyroidism, accounting for the vast majority of cases, is an autoimmune disorder called Graves' disease. In Graves' disease, the immune system makes a mistake. It produces an antibody called thyroid-stimulating immunoglobulin, TSI, that mimics the action of the pituitary hormone that normally tells the thyroid to work. Another common cause is the development of thyroid nodules. These are lumps or growths that form within the thyroid gland. Most of these nodules are benign, meaning they are not cancerous. However, some of them can become hot or toxic, meaning they start producing thyroid hormones on their own, independent of the pituitary gland's signals. If you are experiencing symptoms that suggest an overactive thyroid, the first and most important step is to see your doctor. A diagnosis typically begins with a thorough conversation and a physical exam. During the physical exam, your doctor will carefully feel your neck to check for any enlargement of the thyroid gland, also known as a goiter, or any lumps or nodules that might be present. Your doctor will also look for other physical signs of hyperthyroidism. They will check your pulse to see if it is rapid or maybe irregular. Your reflexes may also be tested, as they are often brisker than normal in people with hyperthyroidism. They may examine your eyes for any signs of bulging or irritation, which can sometimes occur with Graves' disease. They will likely observe your skin for warmth and moisture, and check your hands for any fine tremors. The definitive way to diagnose hyperthyroidism is through a simple set of blood tests. These tests measure the levels of thyroid hormones in your bloodstream. The primary test measures thyroid-stimulating hormone, or TSH, which is the hormone produced by your pituitary gland. Therefore, a very low or undetectable TSH level is a strong indicator of hyperthyroidism. If the blood tests confirm an overactive thyroid, your doctor may recommend further tests to determine the underlying cause. A radioactive iodine uptake, or RAIU, test can be very helpful. A thyroid scan, often done at the same time, can create a picture of your thyroid and show if the overactivity is coming from the whole gland or from specific nodules. Once a diagnosis of hyperthyroidism is confirmed, The main goal of treatment is to bring your thyroid hormone levels back down to normal. This will help relieve your symptoms and prevent long-term health complications. The good news is that there are several highly effective treatment options available. There are 3 primary treatment paths for managing an overactive thyroid: anti-thyroid medications, radioactive iodine therapy, and surgery. The best choice for you will depend on several factors, including the specific cause of your hyperthyroidism, your age, your overall health, and your personal preference. Your doctor will discuss the pros and cons of each approach with you to develop a personalized treatment plan that fits your individual needs and circumstances. Sometimes a doctor may also prescribe other medications such as beta blockers to help manage your immediate symptoms while the primary treatment takes effect. Beta blockers do not stop hormone production, but they can quickly help control symptoms like a rapid heart rate, tremors, and anxiety, making you feel much better while you wait for your hormone levels to normalize. For many people diagnosed with hyperthyroidism, the first line of treatment is often anti-thyroid medication. The 2 most commonly used drugs in the United States are methimazole, also known as tapazole, and propylthiouracil, or PTU. These are prescription pills that you take every day to help manage the condition. These medications work by directly interfering with your thyroid gland's ability to use iodine, which is the essential building block it needs to produce thyroid hormones. By limiting the production of new hormones, these drugs gradually help to lower the overall hormone levels in your bloodstream, allowing your metabolism to slow down to a more normal rate. When you start taking anti-thyroid medication, it does not work instantly. Most people begin to feel a noticeable improvement in their symptoms, such as a slower heart rate and less anxiety, within a few weeks of starting the treatment. However, it can take several months for your thyroid hormone levels to return completely to the normal range. Your doctor will monitor you closely with regular blood tests to ensure the dosage is correct. Treatment with anti-thyroid drugs can last for a year or more. The goal for some patients, particularly those with Graves' disease, is to induce a long-term remission. While generally safe and effective, anti-thyroid medications do come with potential side effects. Most side effects are minor, such as skin rashes, itching, or joint pain. However, in rare cases, more serious side effects can occur. When anti-thyroid medications are not the right long-term solution, or if a patient prefers a more permanent fix, radioactive iodine therapy is a very common and highly effective option. This treatment involves taking a single dose of radioactive iodine, usually in the form of a small capsule or a liquid that you drink. Because your thyroid gland is the main part of your body that absorbs iodine, the radioactive iodine is taken up almost exclusively by your overactive thyroid cells. The term radioactive can sound alarming, but this is a very safe and targeted procedure. The dose of radiation used is very small and specifically targets the thyroid tissue, with very little effect on the rest of your body. The most common outcome of radioactive iodine therapy is that the thyroid becomes underactive, a condition known as hypothyroidism. This is an expected and intended result. Hypothyroidism is much easier and safer to manage long-term than hyperthyroidism. In certain situations, surgery to remove all or part of the thyroid gland, a procedure called a thyroidectomy, may be the best option. Surgery is often recommended for people who have a very large goiter that is causing discomfort or difficulty with breathing or swallowing. A thyroidectomy provides an immediate and permanent cure for hyperthyroidism, as the source of the excess hormones is physically removed from the body. Like radioactive iodine therapy, surgery will almost always result in permanent hypothyroidism, requiring lifelong treatment with a daily thyroid hormone replacement pill. Living with hyperthyroidism involves more than just medical treatments. It also means making thoughtful choices in your daily life to support your well-being. Once your treatment begins to bring your hormone levels under control, focusing on a healthy lifestyle can help you manage any lingering effects and support your recovery. Managing stress is also a key component of living well with a thyroid condition. Incorporating stress-reducing practices into your daily routine can make a big difference. Activities like gentle yoga, meditation, deep breathing exercises, or spending quiet time in nature can help calm your nervous system. It is absolutely crucial to stay consistent with your treatment plan and follow-up appointments. Whether you are taking daily medication or a hormone replacement pill, consistency is key to keeping your body in balance. Regular blood tests will be a part of your life, allowing your doctor to ensure your hormone levels remain in the normal range. Open communication with your healthcare provider is your best tool. Receiving a diagnosis of hyperthyroidism can feel overwhelming at first. But it is important to remember that it is a highly manageable condition. With the right diagnosis, effective treatments, and positive lifestyle adjustments, you can control your symptoms and prevent long-term complications. The journey begins with understanding your body, recognizing the signals it sends, and seeking medical advice. By working closely with your doctor and taking an active role in your own care, you can successfully navigate this path, calm the storm within, and continue to live a full, healthy, and vibrant life.